Hello, I'm Doctor Özgür Akşan from Doctor Özgür Akşan Health, Turkey. I hope you are in a good mood. I am here with a brand new neurosurgery topic. Today I am going to talk about normal pressure hydrocephalus, which is a common complication especially among the elderly, but it is often misunderstood. This topic can be complex and difficult to understand for many people. However, I hope this video will help you. What is normal pressure hydrocephalus? Normal pressure hydrocephalus is a brain condition that usually affects older people, but can affect people of any age. It is caused by an abnormal accumulation of cerebrospinal fluid in the brain. However, unlike standard hydrocephalus, this fluid accumulation does not cause high pressure in the brain. This is why it is called normal pressure hydrocephalus. Normal pressure hydrocephalus has three symptoms, so there are three symptoms. The first is gait disturbance, the second is memory loss, and the third, unfortunately, is urinary incontinence. However, these symptoms can often be confused with Alzheimer's and Parkinson's disease. Understanding and diagnosing this condition requires advanced diagnostic methods such as MRI and lumbar function. However, before these tests can be performed, an accurate clinical assessment is essential. With early and accurate diagnosis, this complex and misunderstood disease can be managed effectively. So what is the diagnostic process and tests? Let us now elaborate on this diagnostic process. The diagnosis of normal pressure hydrocephalus is critical because its symptoms can often be confused with other neurological diseases. Usually the first step is to take a detailed medical history and perform a physical examination. However, more specific tests are needed to make a definitive diagnosis. One of the most commonly used methods is MRI, or magnetic resonance imaging. Magnetic resonance imaging shows the fluid accumulation in the brain in detail and gives doctors the opportunity to confirm the presence of normal pressure hydrocephalus. Another test is also very important, colloquially, and we call it LP. This is the lumbar puncture. This is the process of removing spinal fluid from the lumbar spine. Lumbar puncture is the removal of spinal fluid from the lower back. In the lumbar puncture, the pressure of the spinal fluid is measured and the fluid is sent to the laboratory for analysis. Lumbar puncture is especially critical when the results of other tests are uncertain. Finally, the results of these tests are evaluated by a neurologist or a neurosurgeon. The specialist analyzes the data and formulates the most appropriate treatment plan. The diagnostic process is the first and most important step to improve the patient's quality of life. What are the treatment methods? The most common and effective treatment for normal pressure hydrocephalus is shunt surgery. In this surgical procedure, a tube or shunt is inserted to remove excess brain and spinal fluid that has accumulated in the brain. This shunt usually extends from the brain to the abdominal cavity. After surgery, many patients experience a significant improvement in their symptoms. However, shunt surgery does not have the same effect in every patient, and there are risks. There may be complications such as infection, bleeding, and blockage of the shunt. Therefore, careful medical follow-up is necessary before and after surgery. Alternative treatment methods are also available. However, they are usually not as effective as shunt surgery. Medication, physical therapy, and lifestyle changes may be useful for patients with mild symptoms. However, it is essential to seek the opinion of a neurosurgeon or neurologist about the effectiveness and appropriateness of these options. As mentioned, the most common and effective treatment for normal pressure hydrocephalus is shunt surgery. However, like any surgical procedure, there are risks of side effects and complications. The most common side effects include infection, bleeding, and shunt blockage. The risk of infection is highest in the first few weeks after surgery and can be controlled with antibiotics. A blockage of the shunt can cause the fluid not to flow or not to flow properly and may require emergency surgery. There may also be mechanical problems such as the shunt dislodging or rupturing. Such complications can cause immediate symptoms and should be addressed quickly. Management of side effects requires a multidisciplinary approach. Frequent evaluation and follow-up of patients by neurology or neurosurgery specialists on a regular basis is important to prevent possible complications. Early diagnosis and treatment are critical. Normal pressure hydrocephalus can seriously affect the daily life of patients. Symptoms such as difficulty walking, imbalance, memory loss can lead to limitations in many areas from work life to social relations. This can affect the psychological state of patients or negatively increase depression and anxiety. Therefore, not only medical support but also psychological support and rehabilitation are of great importance in the treatment process. Family members, friends, and social support groups can be a source of morale for patients in this process. Physical therapy and exercises are recommended to improve the quality of life of patients, especially after shunt surgery. Remember that early diagnosis and effective treatment make normal pressure hydrocephalus a manageable condition. However, a multidisciplinary approach and support is essential in this process. Let's now look at risk factors and precautions. Although normal pressure hydrocephalus is more common in people over the age of 60, it can occur in any age group. Risk factors may include previous brain trauma, brain tumors, infections affecting the brain and spinal cord membranes, such as meningitis. In addition, chronic diseases, especially high blood pressure and diabetes, can increase the risk of this disease. Measures that can be taken to minimize these risks include regular health checks, brain scans, and lifestyle changes. In particular, a healthy diet, regular exercise, and stress management can reduce the risk. If you have risk factors, it is important to see your doctor regularly and undergo the necessary tests. Remember, early diagnosis and proactive measures can reduce the risk of complications and improve quality of life. In this video series, we have provided detailed information about what normal pressure hydrocephalus is, symptoms, risk factors, diagnosis, and treatment methods. Stay tuned. www.drozgurakşanturkiye.com to a healthy future. www.drozgurakşanturkiye.com to a healthy future.